Thank you so much for the introduction, and thank you to Magda, who invited me at a conference last year. So I'm honoured to present to this conference. So first of all, I just want to give a brief overview on Alzheimer's disease trials in Australia. Australia has probably a smaller population. Well, we have about 25 million. I'm not sure how that compares with Greece, but over a much wider area, and we have problems with logistics of transport of patients coming to clinical trial centres. So I just want to give a brief overview. First of all, now this is a very busy slide, so I don't expect everyone to understand this, but I just wanted to, the issues of the problems of patients diagnosed with dementia in Australia. Usually they present with symptoms similar to mild cognitive impairment due to Alzheimer's disease. And that could be, memory issues, mood swings, confusion, a lack of interest in activities. But depending on the caregiver or the general practitioner, it can take up to 5 years from the onset of symptoms, when you look back in hindsight, to potential, first of all, referral through to a general practitioner or primary care physician. And then usually they have significant cognitive testings, pathology, and brain imaging. If it's a more complex patient, this is maybe referred to a specialist, either a geriatrician or a neurologist. It's about 24%. And then they have further investigations, potentially a biomarker testing or a PET scanner. And for patients with more atypical features, they might actually be referred to a aged care psychiatrist or a neuropsychologist. And this all takes time. So I think the take-home measure is that this process can take quite a while. It can be quite frustrating for the patient and the caregiver. And in the meantime, the patient's cognition continues to deteriorate. So by the time they actually meet diagnosis, their symptoms have progressed. They may be suitable for treatments such as cholinesterase inhibitor therapy or even potential lifestyle social modifications. By this time, they may have progressed significantly. And this has been a frustration point. And so oftentimes patients have not been diagnosed early enough or been accessed to certain treatments. So finally, after lots of years of lobbying, the Australian government has put together a public consultation paper, and this was aimed to try and address some of these issues. So the voices of patients and the carers have been taken into account. Now, this is still in the very consultative stages. Australia is a federation of 7 states and 2 territories. Sorry, 6 states and 2 territories. And with their complex local state governments and the Commonwealth government, it is a mismatch of potential funding. I just wanted to give an idea of the issues that Australia faces with dementia, and I don't know how this compares with Greece, but I suspect it's similar given the ageing population. So currently, they expected between 386 and 472,000 people living with dementia. We have about 27,000 people under 65 with younger onset dementia. And these cases are both due to rise significantly by the 2050s to approximately 850,000 in 2058 and 30 older patients and 39,000 younger patients. On average, these patients have a 5 times the length of stay in hospital due to delirium or other factors. At present, it's the 3rd leading cause of disease burden in Australia, the 2nd leading cause of death for Australians and leading cause of death for women, and costing approximately 3 billion Australian dollars, approximately 2 billion euros. People affected by dementia, essentially, 1 in 12 Australians aged over 65, 40% those aged over 90. Nearly 2 in 3 of these affected are women, mainly because the males have deceased by that time or had other illnesses. We have a quite wide section, increasingly multicultural community. 28% of those living with dementia were born in non-English speaking countries. And for our Aboriginal and Torres Strait Islander native population, they have 3 to 5 times the rates of dementia and also of younger onset dementia. This obviously affects the caregiver burden. So we have actually about 337,000 unpaid carers. And there's a lack of need of respite care or unpaid carers. Increasingly enough, patients living in residential care facilities. There's not the usual, not the 3-tiered families that might be seen in Mediterranean countries. And so with this, the immediate priorities of this plan is to try to improve timely diagnosis, better post-diagnostic care, increase workforce issues for patients looking at, for carers, and improving supports. And this aiming through to data and collection and intelligence monitoring system. Interestingly enough, whilst there is a priority for research opportunities, it is not part of the initial draft. And that's been an issue for us from the trials community. So I might just move quickly through this, but essentially the aim of the plan was to try and tackle stigma and discrimination, minimise the risk and delaying onset of progression, improving diagnostics and treatment pathways, and supporting people with carers, but also looking at the increasing enough lack of workforce for patients with dementia. And I think the other thing to take home is that, as we all know, there's no dementia experience are the same for either the patient or the carers. In Australia, we have a mismatch of primary care, medical specialists. Patients have difficulty accessing the aged care system, or other community and social supports so the patients remain at home. But also in things of palliative care and with patients that need hospitalisation. So we're only at the infant stage of this plan from 2023, but it's supposed to be a 10-year plan. And with all plans, I think they need to be reviewed and assessed to see if actually the outcomes are achieved. One of the aspects of where dementia care is being headed is the creation of the Australian Dementia Network Registry, or ADNET. Now, ADNET brings together Australia's leading researchers, clinicians and consumers to create a powerful network for dementia prevention, treatment and care. And it established the first dementia clinical registry to try and track, benchmark and report on the clinical care of people with dementia. And then also looking at adopting guidelines from memory clinics around the country to have a standard of care that is ubiquitous throughout. Now, the first report was only created last year. Now, this was during the COVID pandemic. So oftentimes we had quite harsh lockdowns in Australia. So oftentimes patients were not allowed to attend memory clinics face-to-face and often had to have telephone interviews. And this is obviously difficult for patients with a potential dementia diagnosis. But the first report showed that dementia, as we said, was more prevalent in women than in men. Nearly 40% of patients in the registry were actually born outside Australia. 40% were waiting more than 3 months from when they were first referred. And all 3/4 of new diagnoses were of Alzheimer's disease. And nearly 30% of patients with dementia were living alone at the time of diagnosis, indicating potential stressors. Now, turning to the trials, so I was just wanted to give you a brief overview of what dementia is like, or potentially looking at in Australia. But I think in the trials community, there's been, after 3 decades of research and billions of dollars in investment, the news that another Alzheimer's drug has failed often brings disappointment. But for, I think, clinicians and researchers in the space, we have been able to deal with these issues. But thankfully, I think there is hope around the horizon in some of the monoclonal antibodies, some of the other trials as well. And I think this is really the last great bastion in terms of medical innovation. In Australia, there is a clinical trials portal where consumers, clinicians can access. Now, this is for all clinical trials, but also for dementia trials itself. As we know, clinical trials for Alzheimer's disease is difficult. The recruitment targets, the length of the trials can often be long. Patients can often deteriorate during the trial, leading to helplessness from the patient's point, but also from the clinical trial space. And hence, for these specific issues in Alzheimer's disease, Dementia Trials Australia has been formed approximately 20 years. We had a recent name change. Dementia Trials Australia is essentially a professional network of clinicians and other healthcare professionals who are committed to improving treatment of Alzheimer's disease and dementia-related disorders through the cooperative planning, implementation, analysis and reporting of controlled clinical trials and of other research. We have trial centres across every mainland capital city, and increasingly looking at teletrials and regional sites. Australia is a heavily centralised country, so the 5 capital cities have more than 80% of the population. But still, there is a significant amount of patients living in regional or remote areas where have difficult access to care. And oftentimes, these patients have to fly just to get fully assessed. The other purpose of Dementia Trials Australia is to give a thorough review of study protocols, budgets, study logistics, and a guidance on a number of Australian sites to help research organisations identify centres appropriate for any proposed new trial and ensure coordinated strategy for the involvement in the region. We also look at sponsors and determine feasibility when conducting new studies, and to identify potential problems of local ethics committees and grasp an understanding of the local capabilities. It's also a forum of exchange of communication for local clinicians and sponsors. So and the aim of this is to try and improve recruitment and also retention for dementia trials. These are some of the main principal investigators in the country. If you do have relatives in Australia, I know that Melbourne is one of the largest Greek communities outside of Athens. So there are several, if you have relatives in Australia, we have several sites in Melbourne that may be able to help for relatives. And I think the main part for clinical trials is that the research participant is often, needs to be focused as the central part in this trial process between the sponsor, the regulatory agency, local health, human research ethics or the regulation governance organisation, and the principal investigator and the research team. And then oftentimes we need to make sure that we don't lose focus on that. Why do people participate in clinical Alzheimer's trials? Oftentimes there's ups and downs. There's always the downside, the prospect of being on a placebo in a randomised controlled trial. Hospital appointments are long and tedious. In Australia, they often travel long distances, either by road or even rail or air, and oftentimes have multiple procedures and cognitive assessments. So how do we keep patients in trials? Well, I think this, you know, there's always the possibility the patient's on the active component, so there's all that, but also there's altruism in that the patients and the carers feel that they might be helping the next generation. We also celebrate with patients, you know, their birthdays, anniversaries, and I think for the patients, it's not just the prospect of being in a trial and potential improvement from the medication, but it's also that social connection and feeling special. And so I think the key message is that participants and the carers are at the centre of Alzheimer's clinical trials. The goals, despite cultural treatment differences, is to treat Alzheimer's disease. And we know it's not just purely medication, but also that psychosocial benefits as well. And I think we've seen some of the calibre of the speech presentations today. And the aim thing is a lot of these newer trials are longer duration, so the ability to retain patients despite them progressing and becoming more agitated may be an issue. I'll just give you a little perspective on our local health centre at the Prince Charles Hospital in Brisbane. It was established approximately 25 years ago. It's a multidisciplinary unit. We have been involved in over 45 international and national trials involving 350 patients and carers. And we've actually been involved in the marketing and placebo and randomized controlled trials of 5 of the 6 currently marketed drugs for Alzheimer's disease. And it's the largest and only significant unit in Queensland. As I said, these are some of the pictures of keeping patients in trials from our clinical trial staff. So we celebrate anniversaries, birthdays, etc. It might only be small, but for these patients, I think it's very special for them. One example that we also do is we get some of our trials patients to go to art galleries. So in Queensland, we have the Gallery of Modern Art, where they have an art and dementia program where one of the gallery directors actually has an interest in taking some of our patients, but also other patients with dementia in the city to look at relative artworks, but also to be active participants. This is one of the paintings involved, and it's called Under the Jacaranda Tree, which jacarandas are a famous, often common tree here in Brisbane that turn lavender in the springtime months. And this is one of our patients who had no interest in art or activity, but drew this picture when his wife was away. And I don't know if you can see it, but in the bottom corner, he's titled as Lost. And this is when, this is a couple of years ago, he's one of our younger onset patients. When his wife saw this, when he brought it home, she was beside herself. She was so emotionally upset, emotionally happy that he'd actually found something that he could do. And I think we need to, whilst the medications and particular drug treatments, we're always hopeful for benefits, I think we can't lose sight of the psychosocial and those non-pharmacological interventions. So in summary, my presentation was to look at the dementia burden facing Australia, which I'm sure is similar to what maybe is in Greece. Just focused on the Dementia Action Plan and the trials and Dementia Trials Australia, and our targets to recruitment and retention. If you want more information, our Dementia Trials Australia website, we also have an annual scientific meeting every year. So if you're ever coming down to Australia, please come down to visit us. I'd like to leave you with a thought that memory is a way of holding on to the things you love and the things you are, the things you never want to lose. And that's from Kevin Arnold. Happy to take any questions and answers. And if you're ever in Australia, I live in Brisbane and the Gold Coast, where we have wonderful beaches. There's always koalas and kangaroos. Not from my backyard, anyway. So thank you.
We're really grateful for this wonderful presentation.